Welcome back to our One USMLE podcast series, where we tackle the challenging cases you might encounter on the USMLE and in real-life practice. Let's dive straight into today's case. A 45-year-old woman presents to the emergency department with severe epigastric pain that radiates to her back. She mentions that the pain started suddenly a few hours ago after eating a fatty meal. She denies any alcohol use. Her labs show amylase and lipase levels more than 3 times the upper limit of normal. An ultrasonography reveals several gallstones. What is the best next step in management of this case? Think about it, and we'll revisit this after our deep dive. Now let's unpack this. Acute pancreatitis can be a real emergency, most commonly brought on by alcohol abuse or gallstones. Our patient has gallstones and an ALT level above 150 UL, which is a strong indicator of gallstone pancreatitis with a positive predictive value of about 90%. The initial management involves deciding if an urgent ERCP is needed. Remember, ERCP is not indicated just because pancreatitis is present. Urgent ERCP is reserved for cases with a confirmed common bile duct obstruction or acute cholangitis, shown by fever, jaundice, or right upper quadrant pain. If these aren't present, like in our patient's case, we opt for supportive care. This includes IV fluids, pain management, and monitoring, as many stones will pass spontaneously. Back to our case. Given that there's no evidence of cholangitis or CBD obstruction, the correct step would be supportive care. Only after her pancreatitis resolves, we'd recommend an early elective cholecystectomy to prevent future attacks. For those who guessed correctly, well done. Your clinical judgment is sharpening with every case. Now for our next challenge, what complications might arise if our patient's gallstone pancreatitis is not managed correctly? Drop your answers in the comments and let's generate a discussion. If you enjoyed this case study, give us a thumbs up, share with your colleagues, and subscribe for more insights. Until next time, keep learning and stay curious.